Can I ask you something personal? Have you ever gone to bed after eating a light and healthy dinner only to wake up the next morning feeling foggy, dizzy, or just off? Maybe your speech was a little slurred. Maybe your balance felt off when you stepped out of bed. And maybe, just maybe, you brushed it off as aging. I've seen it too many times in my 30 years as a neurologist. Smart, caring people over 60 doing all the right things, eating their vegetables, watching their weight, skipping red meat at night. But then one quiet morning, they can't remember their daughter's name. No warning, no chest pain, just a small clot in a fragile brain vessel. Here's the truth. Not all vegetables are safe for your brain after 60. Some can thin your blood too much, others can spike your blood sugar at night, and a few, when combined with your medications, can quietly increase your risk of stroke while you sleep. If this makes you pause, good, because that pause could save your independence. Today, I'll walk you through 9 common vegetables that may silently work against your brain health, and I'll show you how to eat smarter without giving up the foods you love. If you've ever felt off after a healthy dinner, comment 1 below. If not, comment 0. I'd love to know who's here and listening, and if you care about your brain, hit subscribe. I've made these videos just for you. This is Dr. Brain, and it's time to protect your brain before it needs saving. Number 1. Why your brain after 60 reacts differently to food. Let me tell you something that most health articles leave out. After the age of 60, your brain is not reacting the way it used to, and that's not your fault. It's biology, it's aging, and it's real. In your 40s or 50s, your blood vessels were still flexible. Your kidneys were still filtering efficiently. Your body could handle a heavy meal late at night and bounce back by morning. But now, your blood vessels have become stiffer, your circulation slows down, and your brain, your most sensitive organ, relies on stable oxygen and blood flow like never before. Even a small shift in hydration, blood sugar, or pressure can throw things off. A single vegetable that drains your water. A late night snack that spikes your sugar. A salad that thins your blood too much. All of it matters now. And if you're taking medications for blood pressure, diabetes, or cholesterol, your body isn't just aging. It's adjusting to multiple moving parts at once. Let me ask you this. Have you ever stood up too quickly and felt lightheaded? Have you woken up with brain fog, dry mouth, or forgotten what day it was? That's your body sending signals. You're not just tired, your brain is asking for help. And food, yes, even healthy food, can either support that brain or quietly stress it out. So if you've been told just eat more greens or salads are always safe, I want you to pause. Because after 60, the same food can affect your body in a completely different way. This isn't about blame. It's about understanding. And when you understand how your aging brain works, you can protect it in powerful ways without fear. Tell me this in the comments. Have you noticed any changes in how your body reacts to food now versus 20 years ago? I read every response. Number 2, spinach and broccoli. Stroke risks hiding in healthy meals. Let me tell you a story about Harold. He's 76, a retired firefighter from Wisconsin, disciplined, proud, ate spinach salad every night with olive oil and feta, took calcium and vitamin D to keep his bones strong. He did everything right. But one winter morning, he didn't wake up the same. He was found at the kitchen table, slumped over, coffee spilled. His speech was slurred, his right hand limp. It was a stroke, silent. Overnight, his scan showed something alarming: vascular calcification, hardened brain arteries. His blood showed elevated calcium and oxalate levels. What triggered it? The very thing he thought was saving him: spinach. Here's why. Spinach is rich in oxalates, a compound that binds with calcium. In a young, healthy body, oxalates pass through easily. But after 65, especially if you take calcium or have mild kidney decline. Oxalates begin to build up. They create tiny crystals, like grains of sand, circulating in your blood. Those crystals can harden small blood vessels, especially the ones feeding your brain. Now add broccoli. Broccoli is high in vitamin K, good for clotting, but if you're taking blood thinners like warfarin or aspirin, vitamin K can tip the balance. Too much, your blood gets too thick. Too little, it becomes too thin. Either way, your brain pays the price. I treated a patient, Clara, 82. Every evening she ate steamed broccoli. Took aspirin for her heart. One day she collapsed with a brain bleed. Why? The broccoli had made her blood unpredictable. Let me ask you something. Have you ever changed your diet and noticed bruising, dizziness, a drop in energy? It might not be age, it might be how your food interacts with your medications and blood vessels. Spinach and broccoli aren't bad foods. But after 60, they require a different kind of respect. If you eat spinach or broccoli, especially at night or with supplements, talk to your doctor and keep it consistent. The danger often comes from sudden changes, not steady habits. Have you ever thought a salad could be dangerous? Tell me in the comments below. Number 3, lettuce and carrots. How light dinners become overnight stroke risks. Let's talk about Leon. He was 75, retired from the auto factory in Indiana, walked daily, avoided fried food, ate clean. His favorite dinner? A big bowl of romaine lettuce, cucumbers, vinegar, and a few raw carrots. Light, crunchy, healthy. But one morning he couldn't lift his coffee cup. His wife found him dazed, slurring his words. In the hospital, the scans showed a small clot in his brain. A mild stroke, but enough to change his life. What went wrong? You see, romaine lettuce is a natural diuretic. It gently pulls water out of your system. In younger people, it's barely noticeable. But in seniors, especially those on blood pressure pills, it adds up. Now, combine that with carrots. Carrots may seem innocent, but raw carrots eaten alone spike your blood sugar. That sugar spike triggers insulin, then blood sugar drops during the night. And your body responds with stress hormones like cortisol and adrenaline. They constrict blood vessels, they thicken blood, and that's when clots form. The result? A stroke in your sleep with no warning. You thought you were being healthy. But light and clean isn't always safe. Let me ask, have you ever skipped dinner and just had salad or raw vegetables? Have you woken up with dry mouth, confusion, or tingling in your hands? That might not be aging. It might be overnight dehydration and a sugar crash. My advice, if you love salad, eat it earlier in the day. Never go to bed dehydrated, and never eat carrots alone at night. Always pair them with protein or healthy fat to blunt the blood sugar spike. After 60, your brain needs stability. No surprises. Have you ever felt off after a salad dinner? Share your experience below. Number 4, garlic and onions. Natural remedies that backfire after 60. Let's talk about Thomas. 81 years old, a retired railroad engineer from Missouri. He prided himself on doing things naturally. After his heart procedure, his doctor prescribed a low dose of blood thinner, but Thomas had read that garlic could help the heart. So every night he took a garlic capsule and crushed a clove into his dinner. No one told him to stop. 3 weeks later, Thomas was rushed to the ER with blurred vision and vomiting. His speech was slurred. A brain scan showed a hemorrhagic stroke, a bleed inside the brain. His blood had become too thin to clot. And the garlic? It was no longer a food. It had become a medicine, a powerful one. You see, garlic is a natural anticoagulant. It helps prevent blood clots, which sounds good until it's combined with warfarin, aspirin, Plavix, or any other blood thinner. Together, They push your blood past the safety line, and in a brain with fragile vessels, one tiny rupture can change everything. Now, let's look at onions. Onions contain quercetin, a plant compound that lowers blood pressure. But when paired with medications that already lower blood pressure, beta blockers, ACE inhibitors, it can go too far. The result? Dizzy spells, blackouts, even strokes caused by sudden drops in brain oxygen. Have you ever stood up too fast and had to grab the wall, or felt your heart flutter after eating something natural? That's your body telling you something. Natural doesn't always mean harmless, especially after 60. Garlic and onions are not the enemy, but when you're on heart meds, they require caution and consistency. Talk to your doctor. Tell them about every supplement you take, even the ones in your kitchen, because after 60, the smallest thing can tip the balance. Have you ever felt dizzy or off after eating garlic or onions? Comment below and let's talk about it. Number 5, corn and tomatoes, the hidden sugar storm in your brain. Let's meet Darlene. She's 77, a retired librarian from Iowa. Gentle, routine-driven, never missed her morning bowl of corn grits. In the evening, she enjoyed corn on the cob. Sweet, warm, comforting. It reminded her of childhood. But after a few months, something changed. She started waking up tired, confused, sometimes dizzy. One morning, she stared at her coffee pot for 10 minutes, not remembering how to make it. It wasn't forgetfulness. It was a stroke. Doctors found small clots in her brain's tiny vessels. Her blood sugar levels had been spiking at night. Her morning levels were crashing. The sweet corn? It had been turning into a sugar bomb while she slept. You see, corn may be a vegetable, but it acts like a starch. It's high in natural sugars that convert quickly into glucose. And after 60, our insulin response slows down. Blood sugar spikes harder, crashes deeper. And in that window, between midnight and morning, your brain is most vulnerable. Tomatoes are another hidden trigger. They're acidic. They contain compounds like solanine and histamine that can cause inflammation and nerve agitation, especially in aging bodies. Some seniors experience headaches, vision issues, or even stroke-like symptoms after heavy tomato meals, not because of a clot, but because of a storm in the blood chemistry. Let me ask, have you ever had a tomato-based dinner and felt dizzy, restless, or foggy the next morning? If so, it may not be just a bad night's sleep. It may be your brain reacting to food that no longer fits your body's rhythm. Corn and tomatoes aren't off limits, but you must eat them smart. Avoid corn at night. Don't pair it with sugar or high-carb sides. Tomatoes? Eat them cooked in moderation and never too close to bedtime. Your brain doesn't need surprises. It needs calm. It needs consistency. Have you ever had symptoms after eating corn or tomato-heavy meals? Comment below. Your story may help someone else. Number 6, asparagus and nighttime dehydration. How clean eating quietly thickens your blood. Joanne was 79, a retired school counselor from Colorado Springs. She walked every day, cooked all her meals. She avoided processed food, red meat, and sugar. Her favorite dinner? Steamed asparagus with lemon and a drizzle of olive oil. Light, clean, perfect. Or so she thought. One morning, Joanne woke up confused. She couldn't recall her address. Her speech was slurred. At the hospital, doctors discovered she'd had a small ischemic stroke. No chest pain, no fall, just a clot that had quietly formed during the night. What happened? You see, asparagus is a natural diuretic. It pulls water out of your body, even when you don't realize it. For someone over 60, especially on blood pressure pills or blood thinners, this creates a dangerous effect. Here's what happens. You eat asparagus for dinner, then you go to sleep without drinking much water, maybe to avoid getting up at night. But while you rest, your body keeps losing fluids. Your blood volume decreases. your blood thickens. And thick blood in narrow vessels creates the perfect condition for clot formation. Your brain needs constant, stable blood flow, not syrupy, slow moving blood in aging arteries. Joanne's tests showed low hydration, high hematocrit, and subtle changes in blood viscosity. Nothing extreme, but just enough to block a fragile vessel in her brain. She recovered, thank God, but she needed weeks of speech therapy, and her confidence was shaken. Let me ask you, do you avoid drinking water at night to sleep better? Do you eat clean but still feel dizzy in the morning? You might be unknowingly drying out your brain. Here's my advice. If you eat vegetables like asparagus, always hydrate. Drink a glass of room temperature water before bed. And talk to your doctor if you're combining diuretics, blood thinners, or a low sodium diet. Clean eating is not just about what's on your plate. It's about how your body handles it, especially as it changes. Have you ever felt lightheaded after a healthy dinner? Let me know in the comments. Number 7, nighttime eating. Why even healthy food must follow new rules after 60? Let's talk about something almost every senior does without thinking. A light meal before bed, maybe just a small bowl of soup, a few vegetables, a piece of fruit, or just some crackers to avoid going to bed hungry. Seems harmless, right? But after the age of 60, that harmless habit might quietly become a risk, especially for your brain. Let me explain why. At night, your body enters a slower, more delicate rhythm. Your blood pressure naturally dips. Your body loses water through breathing, not just sweat. Your insulin response slows. Your blood vessels become more sensitive to pressure changes. Now imagine this. You eat a tomato-based soup, acidic, rich in histamines, or a plate of vegetables like corn or carrots, full of starch and sugar. Your blood sugar rises. Then, after a few hours, it crashes. Your body responds with stress hormones like adrenaline and cortisol, narrowing blood vessels, increasing clot risk. And if you're already on blood pressure medication or dealing with diabetes or atrial fibrillation, that blood sugar roller coaster becomes a real danger. Many of my patients who had mild strokes at night had one thing in common. They ate too close to bedtime. Not junk food, not alcohol, just healthy meals at the wrong time. The brain doesn't like change while you sleep. It needs calm, steady support. Let me ask you, do you sometimes snack after 8 p.m.? Do you ever wake up feeling groggy, foggy, or off balance? That may not be insomnia. That may be your brain responding to the wrong fuel at the wrong time. Here's what I recommend. Try to finish your dinner at least 3 hours before bed. If you need a snack, choose protein, not carbs. A boiled egg, a few almonds, or a piece of cheese can help stabilize your night. And don't forget to hydrate with a small glass of water before bed. Not too much to disturb your sleep, just enough to protect your brain from overnight thickening of the blood. Food is not just fuel, it's medicine, or it's a trigger. Which one it becomes depends on when and how you use it. Have you ever felt worse after a healthy late dinner? Let me know below. Your story matters. Number 8, what to eat instead. Safe habits to nourish your brain after 60. By now, you might be wondering if spinach, broccoli, carrots, corn, even tomatoes can be risky, then what's left? What can I eat that supports my brain, not threatens it? Let me tell you, there's still so much you can do. After 30 years treating aging brains, I've found that simple, steady choices, not fancy diets, keep people strong. Let's talk about what works. First, cooked greens like kale, collards, or bok choy. They're easier to digest, lower in oxalates than raw spinach. And when lightly steamed, they release nutrients without overloading your kidneys. Second, Lean protein with dinner. That might be a piece of grilled salmon, a boiled egg, or a bit of turkey. Protein helps regulate blood sugar at night, keeping your brain fed and calm. Third, hydrating fruits during the day, not right before bed. Watermelon, berries, or cantaloupe are rich in antioxidants and water. They support circulation without causing spikes or drops. Fourth, warm liquids like herbal teas in the evening. Chamomile, ginger, or lemon balm can help relax blood vessels and ease your system into restful sleep. And finally, timing. Eating your heaviest meal earlier in the day gives your body time to digest without stress. Your brain prefers slow and steady, not sudden and late. Let me ask you, have you ever felt more clear-headed after a high-protein lunch than after a heavy dinner? That's no coincidence. That's your body telling you what it needs. You're not too old to change. Your body is still responding. Every meal is a message, and your brain is still listening. So choose foods that calm, not spike, that hydrate, not dry out, that protect, not provoke. Start small. Shift your salad to lunch. Add a soft-boiled egg in the evening. Drink 1 glass of water before bed. These aren't sacrifices. They're your brain's quiet allies. What's one food you'll change this week? Let me know in the comments. If you're still watching this, I want you to take a moment, not for me, but for yourself. Breathe, close your eyes, and think about the version of you who still remembers names, who still walks with balance, who still starts each morning knowing what day it is. That version of you is still here. It's not too late. You are not broken. You are aging. And that's something sacred, not shameful. What you've heard today may have surprised you, maybe even scared you a little. But that's not the point. The point is awareness. You see, the greatest danger is not in one vegetable. It's in believing we don't have to adapt. But you're here, you're listening, and that means you're already one step ahead. So today, I ask you to make just one small shift. Move your salad to lunch. Swap carrots for protein in the evening. Add that glass of water before bed, because sometimes that's all it takes to protect your brain from the stroke you'll never see coming. You're not fragile. You're informed, and that makes you powerful. Now, before you go, I want you to see what's next. There's a vegetable sitting in millions of refrigerators right now that most Americans believe is heart healthy. But after 60, it may quietly increase your stroke risk overnight. To protect your brain and your future, watch the next video. This vegetable raises stroke risk after 60. And before you go, leave me a comment. What's one change you'll make after today's video? If this helped you, hit like and subscribe. Let's keep your mind sharp, one habit at a time. This is Dr. Brain. Protect your brain before it needs saving.